Hello and welcome to the last leg of a very special series, Heart Talk. It's an attempt by us to create awareness about congenital heart defects or CHD. This week of February 7th to 14th, is globally recognized for this cause of spreading awareness about CHD cases and, of course, the issue of heart defects. I'm Priyal Guliani, representing Genesis Foundation. I'm also a mother of a CHD child who's no longer present in this physical world. And so I'm truly honored to be part of Genesis Foundation mission of Har Dil Dhadakna Chahe. Today, on this part of the series, I'm joined by someone who is not only very well-known pediatric cardiologist in the country, but also someone who has been a guiding light for Genesis Foundation as a part of its medical board, Dr. Krishna Kumar. Thank you so much for joining us, Dr. Kumar. And I would also like to highlight his other formal introduction, which is he's a clinical professor and head of Department of Pediatric Cardiology at the Amrita Institute of Medical Sciences and Research Center at Kochi. He's been responsible for treating many children with CHD, which even Genesis Foundation has also tried to help and support. And he's one of the doctors who has been committed that every child with CHD receives the necessary treatment irrespective of how much the family earns. So thank you so much, Dr. Kumar, for whatever you do and your contribution in this entire ecosystem to support CHD child and their families.
Thank you, Priyal, and it's an absolute privilege to be partners with Genesis Foundation in this very important mission of taking care of children with congenital heart disease, because it can be very challenging, but at the same time, if we do the right things at the right time, it can be very rewarding.
True. And that brings me to my first question to you, Doctor. Would you say that irrespective of what the CHD diagnosis is and the various kinds of CHD that we have, life of a child and a parent changes with this diagnosis?
To some extent, yes, that's true. But there's such variety with congenital heart disease that it's very difficult to make broad generalizations. But in general, there's one very simple rule. The earlier a diagnosis is made, the more likely that you're dealing with severe disease. So if a diagnosis is made when the child is yet to be born, then usually it's something pretty serious. Otherwise, you can't identify it at such a young stage. Or when the child is just born and you identify it to be a significant heart disease, often that disease requires early attention. So it could also be something very mild, where it doesn't really impact the lives as such. So it's very important to be exactly specific about which condition we are dealing with and then counsel the parents accordingly.
You mentioned early intervention is very key, and I couldn't agree more. But, once you have chartered the course of what the treatment is going to be, I would give my example in case my daughter was born with truncus arteriosus. It was a very, very severe condition. And, while we had the impression that there will be one surgery, and of course, we knew that there'll be regular surgeries during every growth cycle. But in fact, right after the first surgery, there were so many complications apart from the heart issue that came about that for a time frame that she was alive, we almost forgot about the heart, and there were other challenges. So how does that pan out if you were to give us a sense about it?
I think your example is very poignant and very illustrative and reflects a lot of what other parents go through. And it's important to look at congenital heart disease not in isolation. Look at it as a part of something much bigger. In your particular case of truncus arteriosus, often you have immune system problems, airway problems, endocrine issues all coming together, and that highly complicates the picture. The children are often very vulnerable to infection pneumonias. So it makes the whole management very, very complex. So in general, the way I look at congenital heart disease, I think I don't look at heart in isolation. I look at the patient as a whole and see and identify ways by which we can actually try and make sure that we never forget that there are many other aspects to be dealt with to make sure that the child goes home well. And it's really important because 30% of children born with congenital heart disease have some other organ system problem. Nearly 20% could have a genetic problem that is sometimes identifiable, sometimes not. So there are a number of other issues that need to be considered, particularly for the severe forms of congenital heart disease.
Uh, as it is for a parent to understand that a child has an issue, can be very, very daunting. But when, say, a procedure is taken care of, there is the team of doctors have decided what needs to be done. It can also be very daunting for parents to navigate life after the treatment, right? So, how does that work? Do we have the enough support system? Do we have enough guidance that comes in, or is it like a teamwork for the rest of the life that you need to have with the set of doctors around for the well-being of your child?
Yeah, that's true that you should look at congenital heart disease care not as a single procedure. You need to have a life course approach. So once you've treated the condition, you need to recognize that many children need lifelong attention. And you need to put together a system for that purpose. There are, quite honestly, there are significant deficiencies within the Indian framework. And only there are probably isolated examples of hospitals or ecosystems that the hospitals have created that enable a very good lifelong approach to take care of these children. But follow-up care is really important for a large number of congenital heart diseases when even after they have been operated upon or after a procedure has been done. And you need to put together a system, again, not just focusing on the heart, but looking at everything else as well. For example, the child's development, the child's school performance, the other organ systems that may require attention. All those things have to be thought about. Immunization, nutrition, everything has to come into the plan.
Once the procedures are done, once the intervention is done, does that status quo is it the same situation, or does it changes with after the intervention?
Well, often the idea behind doing an intervention is to make the change for the better. But I mean, we cannot completely cure the substrate. So there is, for example, an underlying vulnerability to infections. You can't just eliminate it by doing the surgery. So you have to address that. And you're right that some things continue to be a little more worrisome. Cannot be treated as routine. And you gave a very good example of fever. Well, if a fever lasts for a few days, then you're probably not worried. But if it lasts for a week or so, then you start wondering whether there is an infection focus within the heart, which is a very serious problem. So it does change the situation, and it does bring in an additional amount of stress, which requires a lot of counseling for parents to be able to cope with it.
I would agree, both counseling and I think a support system is something that sometimes parents miss because, the emotional support that you need. But importantly, in your observation, and since you've been a veteran as far as this ecosystem is concerned, how have you over the years seen a CHD child coping up in life for various basic aspects, whether it's schooling, whether it is, adult life?
There are the relatively simple holes in the heart. Once they are fixed, the children can be almost normal physically and often intellectually, mentally, and in terms of learning and school performance. They need a minimum amount of supervision, and they need to be seen every few years. And they often do very well, and they can even participate in competitive sport. At the other end of the spectrum, you have very complex conditions. And truncus would be a good example, or single ventricle physiologies, where there is a lifelong limitation. And That is, of course, a better situation than untreated heart disease, but it is a limitation nonetheless. And that needs to be remembered when these children are growing up. There are challenges, physical, for sure, they cannot compete at the same level of a normal child. And this can bring in a lot of psychological consequences. And this needs to be dealt with through proper education, counseling, and dealing with the environment that the child grows up in. But there are going to be significant other challenges which relate to learning disorders, for example. Many children grow up with congenital heart disease and subsequently experience challenges in school in terms of their ability to learn, their ability to pay attention, their ability to socialize. All these are affected to a varying degree, and they are not necessarily directly related to the heart disease. They are sometimes related to the fact that the child may have an underlying genetic defect that results in heart disease and the learning problem. They may be related to the fact that the child, because of the heart disease, does not get the same brain development in while the child is in the mother's womb because of altered circulation. So a variety of reasons. Then it could be the effect of surgery, it could be the effect of post-operative care. And we are actually in the midst of really studying this very, very much in depth. And this needs to be done. You need to actually, at various regular intervals, determine the child's neurodevelopmental status and tailor your management and guidance according to it. Very often, if you pick up a learning problem and you intervene early, you can actually overcome the challenges.
Okay. One thing, Dr. Kumar, that we personally also saw while we were in hospital for over 4 months with our daughter, and something that brought us together to Genesis Foundation was the finances that play such a crucial role. One is about the detection. Not many families have that amount of finance with them because it's not a very simple affair. It is a cost extent. It's a very costly affair. So, in that regard, where do you think we stand? I still personally believe, despite the fact that it's been quite few years in our situation, the amount of awareness for CHD is still very, very limited amongst, say, a young parent who's going, and probably wanted to get their screenings and things like that. There's no standard protocol that you have to have a fetal echogram after 35 and so on and so forth. So one is, of course, the finance part, which is paramount. If you could, share your views.
I'll touch upon these two separate issues. One is finance and second is screening. First issue is finance. And I think, yes, you're right. It's a massive source of stress to most Indian families. Few states have managed to create a system that enables every single child to get timely access to congenital heart care. Kerala is one of them, with the Hridayam program that has been introduced since 2017. There is a commitment from the government to take care of every single child with congenital heart disease. However, it's not true for the rest of the country. The rest of the country is very much behind in this situation. There is a lot of challenge when it comes to finding resources for individual families. I know that there are many organizations such as Genesis that support, but still, notwithstanding that, the burden of disease is so enormous that it's unlikely that even with all collective efforts, the private sector, the NGOs, everybody together may not be able to cope with the burden. It will require a certain government level intervention. Then it becomes a little complicated because it's maybe possible for simple lesions, but when you go to the complex lesions, and truncus is a good example, it becomes very hard for the government to support because those lesions are not easy to treat. And the post-operative recovery could be variable. The treatment could be very expensive. The implants could be very expensive. So all those things are not easy to standardize and make it affordable. But there are steps. I mean, in all fairness, there is certainly a much better situation today. Of course, Genesis has a lot to do with it, and organizations such as Genesis, and then there are government schemes that are coming in. So that is, the outlook is improving constantly. Now, the second question of screening, actually, congenital heart disease is not easy to screen. If you have to do it in pregnancy, the expertise required is just enormous to try and ensure that every baby is screened and you identify it with precision. It's not easy. So for all practical purposes, that's not realistic. It can be done in a certain fashion, in a sort of a graded fashion, at a staged fashion, but it requires a lot of commitment, effort, and collective expertise. What is more realistic is every single baby that's born can have a pulse oximeter reading done at 24 to 48 hours, and that enables the pickup of a lot of serious heart defects.
That's true.
So that's something that may be realistic, and that's happening in the state of Kerala.
Thank you very much for joining us for this conversation. It was extremely informative. Thank you for what you do on a daily basis to help and support families and guide them through this journey, which can be very tough for them. And thank you to all those who have joined us today for this conversation. And as you heard, Dr. Kumar, that even if we all come together, it will still be less. So I will still urge you to give us some bit of that love and heart for making another child heart beat properly or faster. So please log on to genesis-foundation.net. It's just a click away, and let's work towards Har Dil Dhadakna Chahe. Thank you so much for joining us.